Well, participants from all around the globe, I hope you're well rested and are ready for our last session. Well, the last session here at ASEM Forum on Human Rights of Older Persons is conducted with World Health Organization under the topic of Older Persons in Emergencies and Ageism. Dr. Choi Seong-Jae, Professor Emeritus of Seoul National University, will join the session as the moderator, and Dr. Chung Soondool will be joining us as the panelist on stage. And now let me pass on the mic to our moderator. Dr. Choi Seong-Jae, please.
Yes. Good afternoon, ladies and gentlemen, and distinguished guests. My name is Seong-Jae Choi, Professor Emeritus at the Department of Seoul National University. I am very glad to be a moderator on this last session of this important forum of human rights for the older persons. As a moderator on this session's forum, I sincerely welcome all of you to this session and hope you will actively participate in our presentation and discussions, staying with us to the end of this session. As you may know, in last March, World Health Organization issued the global report on ageism. Yeah, first of all, I and all of you as participants and may have to congratulations WHO on the publication of the global report of ageism. The report seems to be very distinctive in many respects. And I'm sure this report will contribute to facilitating research studies and combating ageism in our aging society. This session has prepared in commemoration of publication of World Health Organization's global report on ageism and its Korean version. May have your Korean audience have these copies here already, and this is English copies that was published in March this year, and also reflecting lessons from the experience of emergency situations such as pandemic, coronavirus disease, and this session has been organized with World Health Organization. Before starting this session, I would like to briefly introduce the speaker, Dr. Vânia de la Fuente-Núñez. I'm not good at speaking and pronunciation in Spanish. Dr. Fuente-Núñez is originally from Spain, and she is a technical officer at the World Health Organization. She joined WHO in 2014. She managed the global campaign of combat ageism at WHO and lead authors of the global report on ageism. This report, she is a lead author of this report. She is a medical doctor and a public health expert with extensive experience working with international organizations, research institutions, and NGOs in the area of aging, ageism, and epidemics and outbreaks, and health research and development. She is multi-language speaker of English, Spanish, French, and German. Yes, she's very, excellent and multi-language speaker. Now, we're going to enjoy what he is going to speak as a, speaker of this session. And Dr. Fuente-Núñez, are you here?
Yes.
Yes.
Can you hear me?
Okay, thank you very much. All right, okay. Would you please start your presentation?
Yes, thank you very much, Professor Choi Seong-Jae. I hope I pronounced your name correctly. I'm also unfortunately not a fluent speaker of Korean, so I probably mispronounced your name, so I apologize for that. It's a great pleasure really to be here today and to commemorate, as you were saying, the translation of the full global report on ageism into Korean. This is the first full translation of the report that we have available, and we're very grateful to the ASEM Global Aging Center for helping with this translation that will hopefully help disseminate the report even further. I'm going to start by trying to share my slides, which hopefully you will be able to see full screen. In just a second. Can you see this? I think you can see the slides, yeah? All right, so before I get started, I wanted to go over the agenda or the structure of this presentation for today. And what I plan to do in the next few minutes is to first give you a little bit of context with regards to demographics and also how older people are affected in emergencies. This will be followed by explaining what ageism is. Then we will go into where we see ageism, and then I will delve into how it affects us, which can respond to that question as to why should we care about ageism. And I will end the presentation by explaining what we can do about it. Hopefully, this will spark interest and actions to combat ageism in emergencies and also beyond. So let us get started with the context. The demographic structure of our societies is changing, as we all know, with populations aging across countries. What you see in this slide is the progressive increase in the percentage of people aged 60 years or older across the world. And you see that the years are changing as I click on the slides. What we also see in this slide is that population aging is relevant to every country. By 2050, 80% of all older people will live in low and middle income countries. We also know that the pace of population aging in many countries is also much faster than has been the case in the past. For example, while France had almost 150 years to adapt to a change from 10% to 20% in the proportion of the population that was older than 60 years, places such as Brazil and India will have slightly more than 20 years to make that same adaptation. We also know that older people are increasingly affected by emergencies, including natural disasters and conflicts. For example, we see that in 2020, 12.3% of the population living in fragile countries were 50 or over. This percentage will increase to 19.2% by 2050. And we know that fragile countries are those where conflict and disasters are more likely to occur. As a percentage of the total population, older people also have the highest death rate of any age group in the context of emergencies. And this is reflected also in the figure that you see on the slide, which comes from the Global Report on Ageism. For example, in the Philippines in 2013, people over 60 represented approximately 7% of the population, and yet accounted for 38% of the fatalities caused by the typhoon Haiyan that same year. We see similar figures in Nepal, where 29% of people who died in the earthquake in 2015 were aged over 60, while older people only represented 88% of the population. In the 2011 Great East Japan earthquake, 56% of those who died were 65 years and older, despite constituting only 23% of the population. More recently, we saw that the vast majority of people who died in Australian bushfires in 2020, apart from those directly involved in the firefighting effort, were over 60. And of course, I think all of the attendees here today would know that in the context of the ongoing COVID-19 pandemic, global evidence has shown that older people face a significantly higher case fatality rate from this disease than people in younger age groups. The case fatality rate of COVID-19 is also increased in those with underlying conditions that affect the immune, cardiovascular, and respiratory systems, and these conditions we know are more common in older age. We have figures that show that in many countries, more than 40% of deaths related to COVID-19 were linked to long-term care facilities, with figures being as high as 80% in these facilities in some high-income countries. Unfortunately, ageism is standing in the way of effective responses to emergencies. But before I explain how ageism manifests in the context of emergencies, let me start by explaining what we mean by ageism. When we talk about ageism, what we're really talking about is how we think, how we feel, and how we act towards other people or towards ourselves based on age. This means that when we talk about ageism, we're really referring to three distinct dimensions: stereotypes, prejudice, and discrimination, which are mutually reinforcing. This means that if I have prejudice towards someone on the basis of their age, this can lead to me having discriminatory actions toward a person. In the same way, if I display discriminatory actions towards another person, this can also affect the way that I think about that person. Something else that I also wanted to flag in this slide is that ageism starts very early in life and is then reinforced over time. Children as young as 4 are already very aware of their own culture's age stereotypes, and they internalize these stereotypes and use them to guide their feelings and behavior towards people of different ages, and also towards themselves. If we are repeatedly exposed to stereotypes about older people, for example, we will eventually start using them to guide our interactions with older people when we're younger, and once we reach old age, these can become self-stereotypes, affecting what we do or what we don't do or how we perform in specific tasks. Stereotypes can be particularly salient in the context of emergencies, where older people tend to be considered as a homogeneous group of frail and vulnerable people and treated as such. This can result, as I was explaining, in older people also internalizing these stereotypes and using them against themselves, limiting their performance or their willingness to engage in certain activities that are not deemed appropriate for older people. What we also see in the report is that ageism is everywhere. It is in our institutions, in our relationships, and in ourselves. Institutional ageism refers to the ageism that we see in social norms, in practices, in laws that regulate institutions, and that systematically disadvantage people on the basis of their age, affecting, for example, the resources that they have access to or the services. We see examples of institutional ageism in healthcare and social care. We see it also in employment, in the media, in housing, again, in most of the institutions that we can think of. Interpersonal ageism refers to that ageism that we see in interactions between 2 or more people. Examples of interpersonal ageism can include, for example, patronizing or disregarding the views and the ideas of older or younger people on the basis of their age, or not allowing them to make decisions for themselves when they have the capacity to do so. And finally, self-directed ageism refers to that ageism that we direct towards ourselves and is the result of that process of internalization of stereotypes through our lifetime, which we eventually then use as self-stereotypes. The report shows that 1 in 2 people are ageist against older people, with rates much higher in low and lower middle income countries, as you see reflected on this slide. This means that half of the world's population has moderate or highly ageist attitudes against older people. Just think about this. This means that either you or the person sitting next to you would have those ageist attitudes against older people. As I was mentioning, ageism is everywhere, and we are all raised in ageist societies. So it's an ism that is normalized and socially accepted. With regards to ageism against younger people, here, unfortunately, we don't have global prevalence data, but we do have data from Europe, which is the only region which has information about the prevalence of ageism against all age groups. And in this region, younger people report more ageism than other age groups. The one that follows is older people, also in this region. As I mentioned, ageism is everywhere, and this includes emergency settings. Despite the figures that I mentioned at the beginning with regards to the fatality rates in emergencies, older people are often neglected or not given due attention in the context of emergencies. They can be excluded from official data systems. For example, in the context of the pandemic, older age groups were frequently excluded from COVID-19 official data systems or are not visible within them. And where data on older age groups is collected, disaggregated data is often not reported or made publicly available. Just think about the amount of time it took for us to get information regarding the case fatality rate in older populations, with information or data sufficiently disaggregated for us to be able to determine who had the highest risk of death within the older age group. In emergencies, older people also face discriminatory practices in access to critical services and resources. This can be seen in the design of refugee camps, for example, which often fail to account for important differences in mobility or ability to access collection points for food or other resources. It has also been very visible during the pandemic of COVID-19, where unfortunately there have been many reports of discriminatory practices in access to health services in several countries, especially among those people living in long-term care facilities. For example, in some contexts, resources that were scarce, such as ventilators or access to intensive care units, were allocated according only to chronological age and excluding older populations from access to those resources. Older people are also systematically stereotyped as vulnerable, dependent, and frail, or as passive recipients of care or services, which fails to account for the many contributions that older people make, as well as the diversity. And this can make preparedness, response, and recovery efforts limited or not adequate for older populations. Importantly, this exposure to stereotypes in media, in public discourse, in access to services, in relationships, they can all have very important and negative impacts on older people's health and well-being, as we will see in a minute. Older people also face disparate access to resources, including opportunities for livelihood in emergencies, and are therefore at higher risk of poverty and malnutrition. a 2020 publication by HelpAge International that included close to 9,000 interviews of older people affected by emergencies in 11 different countries, revealed that 77% had no income and 64% did not have enough to eat. I also wanted to mention that it's important to consider that the multiple risk factors and disadvantages that people accumulate over their life course mean that some groups of older people will face heightened challenges in recovering from an emergency. And yet they tend to remain invisible or to receive the same response as other age groups. Again, this is what happens when older people are considered to be a homogeneous group or are stereotyped as a homogeneous group. In the context of emergencies, older people are also neglected in funding allocated for humanitarian response. An analysis from 2016, included also in the Global Report on Ageism, examined humanitarian funding delivered through the UN Consolidated Appeals process, using this as a proxy indicator for the degree to which the specific needs of older people were reflected in humanitarian programming. And what it found was quite alarming. It found that of the 16,221 projects implemented between the years of 2010 and 2014, only 6% included one or more activities that either directly targeted older people or that included older people alongside other vulnerable groups. And only 51% of the projects included in the 6% were funded. So you have a pie chart here on this slide, which I think clearly reflects the inadequate attention in terms of funding allocated for humanitarian responses for older people. I already mentioned earlier that ageism is harmful, but I wanted to look at this in more detail because I think this slide also tells us why we should really care about ageism and addressing it beyond it being prevalent. We know that ageism has far-reaching impacts on all aspects of our health and well-being when we're older. We know that ageism is, for example, associated with earlier death. This was found in 10 different studies that looked at the relationship between ageism and longevity. And what they all found is that people with negative attitudes towards aging had a higher chance of dying over the period of study than those with more positive self-perceptions. Ageism is also associated with poor physical and mental health. In terms of physical health, here we're talking about the presence of chronic conditions, functional impairment, the number of acute medical events and hospitalizations being increased by ageism. In terms of mental health, we see that ageism is associated with the onset of depression, lifetime depression, and increases in depressive symptoms over time. Based on figures for 2015, globally, it is estimated that about 6.3 million cases of depression are attributable to ageism. We also know that ageism accelerates cognitive decline and that it increases the likelihood of us engaging in risky health behaviors like smoking, not taking prescribed medication, or following an unhealthy diet. It further affects our well-being, decreasing our quality of life and increasing the likelihood of social isolation and loneliness. Finally, we see that ageism is not only harmful in itself, but it also exacerbates other forms of disadvantage, including those related to sex, race, and disability. With exposure to these disadvantages being particularly acute in the context of emergencies, which can again further harm those individuals affected by ageism and other forms of disadvantage. The report concludes with 3 recommendations for action based on the evidence that we have. The first one is to invest in 3 evidence-based strategies to address ageism. We also need to improve data and research to gain a better understanding of ageism and how to reduce it. And finally, the report recommends that we build a movement to change the existing negative narrative around age and aging. I will now talk about each of these recommendations in detail. With regards to the first recommendation, investing in evidence-based strategies. Well, thanks to the report, we now know that 3 strategies work in addressing ageism: policy and law, educational activities, and intergenerational interventions. Policy and law can address discrimination and inequality on the basis of age and protect the human rights of everyone, everywhere. What's most important about this strategy is that it can help us address ageism against any age group. Of course, it's not just enough to have a policy or a law as a document. It's incredibly important to have mechanisms in place to ensure the effective implementation and monitoring of those policies and laws, to make sure that they're actually applied in practice. It's equally important for policy and law to be effective in addressing ageism that there is public awareness about the legislation or the policy and clarity on its provisions. And this makes sense. For legislation or policy to have effects in a given community, at least some members of the public need to be aware of its existence. This is needed to ensure that it has an instrumental effect such that the individual aims to avoid the specific penalties in the law, and also for individuals to be aware that they can file complaints if they experience violations of the law. The second strategy that works in addressing ageism is educational activities, which can enhance empathy, dispel misconceptions about aging or different age groups, and also reduce prejudice by providing accurate information or counter-stereotypical examples. Educational activities can be included in all levels of education, so from kindergarten up to higher education and lifelong learning, and they can be included in formal and non-formal education. They are very diverse in terms of the activities that can be included. These can be courses that transmit information, knowledge, and skills about the aging process, for example, as well as activities like role-playing, simulation, and virtual reality. Educational activities are among the most effective strategies for reducing ageism against older people, but we don't know that much about their effectiveness for reducing ageism against younger people. This is one area that warrants further research. And the third strategy that we know is effective in addressing stereotypes and prejudice are intergenerational interventions, which bring together younger and older people and foster this interaction between generations. What they aim to do is, again, to bring together different age groups so that they work on a common task that is of interest to both. These are also very diverse. They can be as diverse as our interests may be. So I may be passionate, for example, about storytelling, so maybe I would engage in an intergenerational intervention that involves storytelling and where I would share stories and the other person would share their own stories. But they can also include activities like gardening, music, co-housing, and as many as you can probably think of in terms of interests that you may have. These interventions are very effective for reducing ageism against older people and are also very promising for reducing ageism against younger people. Where possible, the report does recommend investing in these 3 types of strategies in parallel to maximize effectiveness. If we move now to the second recommendation of the report, this dealt with improving data and research. And I think over the course of the presentation, you've already picked up a few areas where there are important gaps in terms of the research that is available. But I wanted to highlight perhaps 3 points in terms of some key gaps that we hope will be addressed in the coming years. The first one, and it's a very important one, kind of the basis for all of the work that we hope will follow, is the importance of using the conceptual framework of ageism that is provided in the report, which is the result of a decades-long process of refinement and consultation among experts in the field. And the reason why it's important to continue with this conceptual framework is that it can facilitate comparability across studies and ensure that everyone working in this area understands the same when they talk about ageism. One of the challenges that we had in producing the report is that sometimes people talked about ageism and referred to different things when using that same term, which, as you can imagine, makes that process of comparability across studies quite challenging. We also need more and better quantitative and qualitative research, particularly in low and middle income countries, where unfortunately there aren't yet that many studies looking at ageism, which of course does not allow us to see the specificities in those contexts. And throughout the report, we do flag chapter by chapter opportunities for research in specific areas. Some examples of areas that warrant further research are included in the slide. For example, more research on the prevalence and the distribution of all forms of ageism against both older and younger people, and including in emergency settings, where unfortunately research yet tends to be even more limited than in other settings, and where we don't yet have as much information with regards to ageism. It's also very important to further study the intersection of ageism with other forms of disadvantage. In the report, we summarize those areas that have some research, which include, for example, the intersection between ageism and sexism, and the intersection between ageism and ableism. But even there is some research, but we believe there's still a lot more to study, even within those intersections that I just mentioned that have been studied, but also with regards to other intersections where we did not find much evidence. And finally, there is this need to further research effective strategies and promising strategies. We need implementation research to help identify the essential components of effective strategies, including in emergency settings, to develop and test new strategies in multi-country trials, and to adapt existing interventions to new contexts, exploring barriers and facilitators of large-scale implementation of strategies to reduce ageism. And finally, with regards to the last recommendation of the report, we need to build a movement to change the narrative around age and aging. This narrative is currently very negative, and it's still accepted as a narrative that we all have and that we're all exposed to on our day-to-day lives. We need to end this stereotypical portrayal of older people in emergencies, which leads to their invisibility or their consideration as passive, vulnerable recipients of services. Unless the humanitarian sector, together with other sectors, ends this narrative, we won't be able to provide adequate preparedness, response, and recovery efforts. Changing this narrative is possible, but it depends on every single one of us. We all have been raised, as I mentioned earlier, in an ageist society, one where ageism is socially accepted and rarely challenged. But it is up to all of us to change the narrative, to question the stereotypes and prejudice that we may hold, and to challenge ageism where we see it. To enable everyone to get started in this process of change and to start taking action, we have put together a living toolkit for the global campaign to combat ageism, which you see on the slide. It contains key messages about ageism, guides for generating conversations with different stakeholder groups, including with your family and friends, a guide to help you organize events, PowerPoint presentations that are similar to the one that I'm using today, and a wide range of communication assets, including social media tiles, infographics, films, Instagram stickers, and many more, which can be used as part of this effort to reach beyond your immediate community, using the campaign hashtag A World for All Ages. To further support the creation of a movement, the global campaign to combat ageism is currently running a sustained theme or initiative on ageism that started on the 1st of October, which was the International Day of Older Persons, and which will end on the 20th of November of this year, which is World Children's Day. The title of the sustained theme is Ageism Through the Ages, and what it aims to do is to give focused attention to ageism as it affects different age groups. During this month and a half, content related to ageism is being released on the platform for the Decade of Healthy Aging and on different social media platforms using this life course lens and giving initial focus to ageism as it affects older people at the beginning of October and moving the focus progressively towards ageism as it affects younger people and children. Valuable initiatives, projects, and expertise about ageism do exist around the world. Each one of those can create ripples of change in their respective context. And our aim with this initiative is to give echo to these efforts so that they are available to the wider community. A series of events on ageism, including this one, are also being offered during this time, which we hope can engage as many people as possible in as many countries as possible. I didn't want to end this presentation without highlighting, which was highlighted also at the beginning of the session today, that the full global report on ageism is now available in Korean. I can't thank the ASEM Global Aging Center enough for their help in translating this report and making it available in Korean so that more people can access it, learn about what ageism is, and hopefully take action so that we can together build a world for all ages. I wanted to thank all of you for your attention today, and I look forward to the discussions and any questions that may come up from the audience. Thank you very much.
Thank you very much for your precise and concise and presentation with summarizing and also emphasis with the older person's emergency situation. Is very vulnerable to the groups that compared to other age groups. And also your last emphasis on changing the narratives. It's really we have to do in everyday lives. Thank you very much for your presentation. And a little bit over the time that we have expected. Anyway, very good presentation. We enjoyed. Thank you very much. Now, next we will have a discussion time, and I would like to introduce three discussants. And we have here one discussion from Korea, and the other two is far away from this place. And the first discussion is Ms. Abou Rafeh Amal is away from here, and also the Jemma Stovell is also away from here, and Ms. Abou Amal have some, have a problem in attending this session because of the New York Times, United States, the New York Times is very over the midnight, and she cannot sit at that late on night, and she and her discussions was given by video. Yes. Could you play the video? Okay.
Good afternoon, everyone.
Okay.
Thank you so much for including me in today's session, and apologies for not joining you live due to the time difference. Hopefully, we will meet in person soon at your event next year or here at the UN headquarters in New York. By now, we heard speakers highlight that as the world's population grows older, large number of older persons will correspondingly be affected by humanitarian crises, especially in developing regions, which is where the pace of population aging is advancing the fastest. But we had a plan. Our team organized an expert group meeting in 2019. Some of those experts are members of your forum. Our session's key speaker, Dr. Vânia de la Fuente-Núñez, as well as Sylvia Perel-Levine, Matthew Wells, Professor Supriya Akarkar, and Dr. Sari Timur. The plan was to generate recommendations on older persons in emergency situations, present that in the UN Secretary General's report, to promote and advocate this issue amongst the delegates negotiating the Annual General Assembly Resolution on Aging in New York. The experts were clear. Older persons are not a homogeneous group, and many are at risk in emergencies, and their specific circumstances and needs are not always fully recognized and considered at all phases of humanitarian action. Older persons may require targeted actions to incorporate their needs and circumstances into humanitarian response. Research shows that between 2010 and 2014, less than 1% of implemented humanitarian projects included any activity targeted at older persons. There's often a lack of necessary skills among first and second responders and volunteers to understand, identify, and address the specific needs of older persons. And as we will likely hear from our colleague Jemma at HelpAge International, older persons report significant barriers in gaining access to humanitarian assistance. This marginalization in humanitarian action is often aggravated by a limited understanding by donors of how programs and projects affect older persons, which translates into a lack of explicit requirements on addressing the needs and situation of older persons in the programs and projects that they fund. All of this exacerbates the likelihood of exposing older persons to protection risks, which render them more vulnerable to and disproportionately affected by emergency crises. Experts noted that stereotyping, prejudice, and discrimination against older people on the basis of their age is often exacerbated during a crisis. You can see some examples on the slide. This can result in a lack of focus on the specific needs of older persons and/or committed resources to relevant policies and actions. All these assumptions permeate the humanitarian system and result in a biased response that is neither age-sensitive nor inclusive of older persons or their capacities, contributions, and frequently their standing in the community. It is important to underline the roles that older persons, in particular older women, play during emergencies. You can see some of the many examples on the slide. The knowledge and skills of older persons can be invaluable. Such new roles should be recognized by humanitarian actors and donors so that older persons and their families receive appropriate, tailored support. However, to bring visibility, voice, and inclusion to older persons and fully understand and address these needs, as well as recognize their contributions, there is a need for consistent collection, processing, dissemination, analysis, and use of data disaggregated by age, including older age, sex, and disability in all phases of humanitarian crises. Later that year, and based on the findings of the expert group meeting, the Secretary General submitted a report to the 74th session of the General Assembly, highlighting key issues and existing normative frameworks, as well as challenges and opportunities in responding to the rights and needs of older persons in emergency crises. The report also includes 5 key recommendations for consideration by the Assembly, which you can find in the link that we've placed on the slide to the report. When we set this plan in motion, we observed the invisibility of older persons in humanitarian resolutions of the General Assembly, where older persons are only mentioned along the other vulnerable groups and have never had a dedicated specific paragraph, as is the case for other groups. Also, at the same time, the ECOSOC had addressed older persons with a specific paragraph, but it was a general paragraph in the preamble, which does not provide guidance to countries on how to mainstream older persons in emergencies. Now the research and findings were in the hands of New York delegates, and following a fierce debate, member states adopted a resolution with additions to the operational paragraph on older persons in emergency situations. This is the text highlighted in blue on the slide, where they utilized 3 out of 5 of the recommendations by the Secretary General. As you can see, this is a stepping stone in an uphill battle that requires all hands on deck. I thank you for your attention, and from all of us here at the DESA Program on Aging in New York, we wish you all the best in your deliberations.
Okay, she presented by a videotape, and because she couldn't participate in discussions, and because of the time differences, you may understand what the situation is this. Also, we have another presenter and from Korea, and I'd like to let me introduce, I forgot to introduce that first discussant. Ms. Abou Rafeh Amal is the Chief Program of Aging Unit at United Nations Department of Economic and Social Affairs. She is originally from Saudi Arabia, and she has joined the United Nations since 201 and worked in the area of social policy, sustainable development, and demography. And she also served on the Secretariat of the General Assembly's open-ended working group on aging, and is a member of the steering committee of the Teachfield City Group on age-related statistics and age disaggregated data. Okay, I'm sorry that I forgot to introduce yourself before your discussion. Okay, next is Dr. Soondool Chung. I would like to introduce briefly her. Dr. Chung is a professor at the Department of Social Welfare, Ewha Women's University in Korea. And she is an expert in the field of gerontological social work and case management, and depression, and baby boomers, and retirement preparations, and aging duration. She served as an editor of Journal of Korean Gerontology, associate president of Korea Gerontological Society, and professional reviewer for several professional journals in gerontology and social sciences. She has an extensive published papers in domestic and international journal of gerontology. Dr. Chung, would you please have your discussion?
Good afternoon, everybody. I'm Soondool Chung, professor of Ewha Women's University. First of all, I'm very pleased to participate as a discussant in 2021 ASEM Forum on the Human Rights of Older Persons. I think today's discussion is very important because we discuss about the ageism and ageism in disastrous situations such as COVID-19. In March 2021, a global report on ageism was published by the WHO, outlining the nature of ageism, evidence-based practice issues on ageism, the impact of ageism, determinants of ageism on older persons and countermeasures to overcome ageism. Because ageism, which is based on discrimination against older adults, is closely associated with their physical and mental health. It is considered to be a serious problem that deteriorates the quality of life in older adults, and furthermore, disturb active aging. The report is meaningful in that it suggested various ways to deal with ageism in light of addressing such issues. I heard that ASEM Global Aging Center translated this report into Korean, and I hope that today's publication of the translated version of the report will serve as a strong foundation in resolving the problem of ageism. I would like to proceed with today's discussion from 4 aspects. First, why we should focus on ageism again. Second, how is ageism in Korean society? Third, the importance of EBP, evidence-based practice, for ageism. Fourth, the strategies to combat ageism. 3 and 4th discussion topic, I would like to add some perspectives to the global report on ageism of WHO. The first topic is on why we should focus on ageism. Ageism is associated with longer lifespan due to aging, as we are predicted to live to the age of 100 compared to life expectancy of 60 in the past. We have to spend more than 30 years as an older person. The life expectancy of Korean, now 83.3 years, has increased by 3.3 years in 10 years, which is higher than the average of OECD countries is 81 years. However, older adults who were once highly respected under the Confucian value in Korea are no longer considered to be productive anymore. Our society's practice of judging people for their productivity has turned into the older population into the images of helplessness and incompetence. Due to this, the role of older adults has been disappeared. In addition, the older population is classified as a vulnerable group in the unprecedented crisis situation of COVID-19, as they are known to have a high risk for infection and high mortality rate. In order to protect and ensure safety of older adults, some discussions policies on isolating and containing the older population. Protecting older adults from infection is an important issue, but it can be also seen as a violation of human rights that does not respect their opinion. Furthermore, defining older adults as a vulnerable population without considering their individual characteristics or environment does not only threaten their survival, but also reinforce negative perceptions on older population, and consequently impede social integration. Therefore, such discussion itself can carry the risk of discriminating the older population. Second topic examines ageism in Korean society. Ageism, discriminating someone based on their age, is one of the 3 types of discrimination along with sexism and racism. However, what separates ageism from the other 2 is that everyone is prone to experiencing ageism because everyone becomes old at one point in their life. According to the 2020 Human Rights Statistics in Korea, age discrimination was appeared to be the second largest after economic discrimination. In addition, According to the survey result of a National Human Rights Commission 2018, it was reported that 21% of older adults have experienced discrimination at least once. Next, discrimination in labor market occupies the highest rate among the areas of discrimination against the older population. In a survey of values and perceptions on demographic change, family, age, and generation, majority of respondents agreed on the question, old age is too old to start a new job or learn skills and knowledge. And 87.6% agreed on the question, it is difficult for older adults to find a suitable job where they can demonstrate their abilities, indicating that older adults are perceived as unproductive, and it can be seen they are being discriminated against in labor market. Next, many things have taken place in our daily life after COVID-19. For instance, dependence on digital device has increased. As we obtain information on COVID-19 through our computers and smartphones. However, only 51.7% of older adults use computer, tablet PC, and smartphones compared to 70% of them utilizing TV and radio. And there was a little change in the time and frequency of uses among older adults. The information gap between older adults and younger people, expressed as a digital divide, is pointed out to be a bigger problem amidst COVID-19. And it is becoming a new form of discrimination against the older adult. For example, increased cases of hate speech against the older adults are observed on websites where users can remain anonymous. One interesting news article pointed out that how AI is not good at recognizing expressions of hatred and filtering them. In a situation where information on COVID-19 is transmitted through digital devices, and where non-face-to-face and online activities are increasing, older adults who have low levels of information are put at risk for social exclusion and a threat for their life. Therefore, policy support to overcome the digital divide should be provided, and face-to-face activities should be maintained in consideration of older adults, even in the era of a non-face-to-face contact society. Third issues, evidence-based practice research is required to help understand ageism. Here, two issues can be raised. One is the scale for measuring ageism, and the other is the mechanism for identifying ageism. First, the WHO report raised the question regarding the scale for measuring ageism. Because most of the scales that measure ageism are based on subjective perceptions, there are difficulties in measuring direct discriminatory behavior. In the ageism scale, it is important to understand not only the perception of older adults, but also the behavior dimension in terms of discrimination. However, most of ageism scales are constituted of factors such as bias, stereotypes, and negative attitude. In addition, because the behavior element mainly contain verbal expressions of a hostile tone, verbal expressions, and verbal violence and avoidance of contact, the indicators for discriminatory behavior are not sufficiently reflective of other behaviors other than verbal contents. Therefore, it is necessary to develop a scale that covers all of the dimensions of perception, emotion, and behavior of ageism. Next, I'd like to talk about the mechanism of ageism. The relationship between terms related to ageism, such as discrimination, stigma, stereotype, prejudice, and exclusion, along with the mechanism for ageism, should be clarified. Age discrimination refers to a combination of negative attitude based on prejudice against older adults and aging. And there exist perspectives that regard discrimination as an attribute of stigma or as a result of stigma. In addition, as many older adults stay in simple, temporary, and low-wage jobs due to prevalent ageism in the labor market, such discrimination along with retirement policies can lead to social exclusion of older adults from the society. Concepts of prejudice, stereotypes, discrimination, stigma, and exclusion are related to negative perceptions and are often used interchangeably in studies. However, there are very few studies that examine the mechanism of relationships among those concepts. In the research of Chung and Park, actually, I conducted this research. Knowledge attitude behavior model, I used this model to explain the causal relationship between knowledge, attitude, and discriminatory behavior toward old adults. The result of this study shows how knowledge on older adults acted as a factor in shaping attitude toward older adults, leading to ageism and discriminatory behavior. Therefore, it is necessary to investigate the mechanism leading to ageism in consideration of its concept to prevent and reduce discrimination against older adults. Let's move on to the final part, fourth. Fourth is regarding the strategies in combating ageism. I will examine 4 ways to do so. First, the strategy is related to on age-sensitive policy. I would like to suggest mainstreaming aging as one of the strategies to combat ageism. All age groups make equally important contributions to society and to their communities and families. Older persons can make their knowledge and experience available to the society to ensure that they can remain active and independent for as long as possible. Policies supporting their social and economic integration in all spheres of society are necessary. To achieve this complex goal, a holistic approach whereby aging is integrated in all policy fields is needed. Therefore, mainstreaming aging is a strategy, process, and multidimensional effort of integrating aging issues into all policy fields and all policy levels. Successful mainstreaming means including all relevant stakeholders in decision-making to ensure that the needs of all age groups are met in all policy fields. Mainstreaming can be seen as an important tool for achieving a society for ages. Second strategy is the need for education on ageism from childhood. As the social and cultural gap experienced by different generations of the society become wider in a rapidly changing society, the opportunities to communicate with other generations are decreasing. Under these circumstances, it is not surprising to see younger generations to have difficulties in understanding the views and behaviors of older generations. Therefore, education is needed to give deeper understanding of older generation to younger generation, and to provide with more knowledge regarding old age in the course of lifespan. Such education should be included in the regular curriculum in school, and diverse programs that allow direct interaction with the older generation should be provided. Also, as in the WHO report, they present how the experiences during childhood continue to affect them later throughout life. A result of a survey also reported that a 3-year-old child was already aware of ageism. Therefore, it would be better to start the education from an early age. It was discussed already at the presenter of this session. Third strategy is to utilize awareness improvement using media, especially the use of discrimination awareness campaigns such as public service advertisements in Korea. Recently, various forms of media play a major role in our daily life, regardless of our age, and they are affecting the formation of social awareness, consciously and unconsciously. Because older adults are often portrayed as passive and dependent beings in the media, efforts are needed to improve the perception of older adults by showing more positive and active images of them through the media. In particular, concise and visual elements should be considered when comparing positive images of older adults for younger generation, rather than having standardized advertisement format or lengthy content. Korean public service advertisement, which are advertisement produced for public interest, can come into play here. For instance, image of one person, both as a young person and an older person, can be overlapped to improve the perception of older adults, and it is shown in the form of both male and female. Such advertisement would provide a message that everyone can age and that no one should be discriminated, which could be the future of myself. Efforts should be made to improve awareness through this method. Last thing, empowerment of older adults is needed to actively respond to discrimination. Older adults often do not recognize discrimination by themselves, and those who do experience discrimination often give up and respond passively to such situations. Therefore, it is necessary to strengthen the capabilities of older adults so that they are able to express their opinions actively with confidence to the discrimination they are experiencing. In addition, increased social roles of older adults through active social participation, such as jobs and social contribution activities, will help to improve the independence and empowerment of older adults. Yeah, that's all. Thank you.
Yeah, thank you very much for Dr. Chung. We have another discussant from Australia. I know that she is in Sydney. Are you in Sydney, right? Dr. Jemma Stovell, and I would like to introduce briefly Dr. Jemma Stovell. And Dr. Jemma Stovell is Global Voice Advisor, HelpAge International. Dr. Stovell is from Australia and holds a doctoral degree in international relations and international development. She started her career working for Amnesty International in Australia. She moved to UK and has worked at the international HelpAge International since 2014. And she has been leading the organization's ageism work for the past 4 years. She has been responsible for ageism capacity building initiatives and has delivered training for various NGOs in many countries. Okay, you have waited a little bit more time, and could you please do your discussion? Yeah.
Good afternoon, and thank you very much to the organisers of this really important event and the opportunity to be a discussant in this session. And thank you to Vânia for your presentation. And although I've read the report and attended a number of webinars and findings, no matter how many presentations I've attended, I still find it enlightening and that there are new things that jump out at me every time. And this time it was the information about the percentage of older people impacted in emergencies and how we really must do more to tackle ageism in all settings. Ageism is a human rights issue that we know often remains invisible. It feels like ageism is starting to be more understood and is starting to be something that is challenged. But I know that when I talk to my friends and family about ageism, it is still something that is not taken as seriously as other forms of discrimination. Ageism is so pervasive in our societies that it largely goes unrecognised. As one of the speakers shared yesterday, I think it's important to recognise that while the COVID-19 pandemic in many contexts has exposed ageism, the pandemic has done just that, exposed what has already been there. Age-based measures to restrict older people's movement have been a common response at every stage of the pandemic. They have been implemented in countries around the world in the initial stages of lockdown and as countries have come out of them. They include preventing older people of a certain age, for example, those over 65 or 70 years old to leave their homes or to go back to work. They've prevented older people from visiting shopping malls and restaurants or participating in religious activities or using public transport. At the early stages of the COVID-19 pandemic, we reached out to our network members with a survey, asking them about what older people's experiences were during the pandemic. Respondents reported that older people's needs are a low priority in many places, including amongst politicians and policymakers. One person said that older people are culturally and politically disregarded and excluded. Many also reported that stereotyping and discrimination against older people, as well as a solidifying of ageist attitudes. This was said to be related to older people being at heightened risk of serious illness and death from COVID-19, but also the miscommunication or misunderstanding that the virus is therefore only a threat to older age groups. As a result, older people were reported to be seen as a homogenous group. As countries have rolled out the vaccination programs, older people have been prioritised on paper, but they have experienced barriers in their right to vaccinations. In some countries, programs have been rolled out digitally and older people have been excluded. For me, the global report on ageism launched earlier this year, it really arrived at a time that we needed it. At the end of a year when COVID-19 had a devastating toll on the lives of many older people, the report helped to expose ageism and helped to show the nature, scale, impact, and determinants of the problem. In providing an overview of the nature of ageism, the report highlights a growing number of studies that have explored the interactions and intersections between the different isms, and this was something that Vânia highlighted in her presentation. The two forms of intersections that have been explored in more detail is ageism and ableism, and ageism and sexism. I was pleased to see the report referencing gendered ageism and using witchcraft as an example of the ways that ageism and sexism can manifest. Importantly, one of the suggested areas for future research is how ageism intersects with other isms. In some cases, we need research to understand more about the problem, and in other areas, we need action. For example, the report reveals how accusations of witchcraft and discrimination directed at older widows is one manifestation of ageism. Just last week, 4 older women were killed in Kenya, in Kisii County, on accusations of witchcraft. HelpAge, along with the Kenyan Human Rights Commission and a number of other organisations in consortium, have worked to mobilise the media for a press conference and will continue sustained advocacy on this issue. Ageism doesn't operate in a vacuum. We need to understand how different cultural practices may help to sustain ageism, like witchcraft allegations, and how age stereotypes differ in context and culture. As an organisation that works in low and middle income countries, this is crucial and the recommendations in the report to fill research gaps is greatly needed. This will help us to know more about the impact of ageism in the countries that we work, and to understand how ageism may vary across individual characteristics. The strategies that the report lay out are really useful for us as a civil society organisation, and I'm sure for others. The strategy on educational interventions shows us that some of the activities that we've been engaging in are evidence-based. For example, our network members in a number of countries engage universities to provide information to students about the rights of older people and the work that they do at the national level. Implementing intergenerational activities is something that we've incorporated into our programming for a number of years, although we haven't been sort of collecting evidence about some of the impacts of that. And so knowing that these activities help to reduce ageism means that we will try to ensure that these kinds of activities continue to be built in more systematically. We hope to build more intergenerational partnerships, and we hope to incorporate both educational and intergenerational activities, because as Vânia mentioned, this helps the effectiveness. Overall, I found the report hopeful and reassuring to know that we can all do something about ageism. The final chapter highlights what specific stakeholder groups can do, providing us with clear actions that we can take forward as academic institutions, governments, United Nations agencies, civil society, and the private sector. After a year that has been so devastating on the lives of many older people, it was encouraging to see the launch of the Global Report, as well as a new report on ageism and age discrimination published by the UN independent expert on the rights of older people, and also a recent substantive resolution passed at the 48th session of the Human Rights Council focused on ageism and age discrimination. It feels like there is momentum, but what we really need and what HelpAge continues to advocate for is a new convention. And we were really pleased to see that this was also recognised in the Global Report, where it stated that international policy and legislative guarantees against age discrimination should be increased, and that an international convention could turn aspirations into a binding obligation. This would mean that we would have a framework that would guide older people's human rights. The Global Report has put the spotlight on ageism in such a way that it seems like it cannot be ignored. Thank you to my colleagues at the World Health Organization and the other UN agencies in bringing this report to us. I believe that it will help all of us to address ageism and create a more equal world for all of us as we age in emergency and other settings. Thank you very much.
Thank you very much, Dr. Stovell. And we have presentation and discussions of 3 persons, and we are a little bit getting later, but we still have about 25 minutes is left. I would like to give an opportunity to the doctor, Fuente-Núñez, of any response to the discussion, what they say, and then we come back to the discussions among our participants and presenters and discussions. All right, would you please? We have any comment of the answer or something like what you want to talk about?
Yes, sorry, thank you very much for giving me the floor now. I was listening and really welcomed all the contributions of Amal, Abou, Rafeh from UNDESA, from my colleague in Korea, providing a very concrete context of what is happening also at country level. And I've been actually taking notes about some of the experiences that you were mentioning, and how, for example, the reflection that you were having, which I think affects other contexts in terms of the value that is given to productivity and how that affects how older people are valued. And I was just in recent discussions earlier this week and last week, and this came up as a common theme affecting older people, but also younger people before they enter the workforce. So it's interesting to also see these commonalities across countries. Same with the comments that you were making about the stereotypes of, the common stereotype of incompetence and friendliness for older people that you say is reflected in Korea, which I think is also reflected in many other countries based on the research that we have. And it's interesting to see the commonalities, but also see the differences that I think Jemma was speaking about in terms of that research that is needed in those areas where we unfortunately don't know that much. And because we don't know that much, we don't know the specificities and how people do experience ageism in those contexts. I also really welcome those contributions around the digital divide and how that has particularly affected older people in the context of the pandemic, where we have made a major shift to the use of technology, and where older people who don't have access to technology, or who do have access to it but do not use it frequently, maybe because they've internalized stereotypes or because they're not provided with that access, how that affects then their ability to continue to enjoy things that they were doing before and that suddenly they can't do. On that aspect, and we speak about it in the report, but not in depth, because there's still not a lot of research. But the digital divide also, I mean, ageism is also present in technology in terms of how technologies are designed, and also the fact that there's this common stereotype that older people are technophobic or disinterested, or they just don't want to update technology, which we then see is not necessarily the case once they're given the chance to use it. But this is one of those areas where it's important to learn more about what are those barriers and how is ageism contributing to the persistence of that digital divide moving forward. And Jemma, I thank you again for highlighting the importance of looking at intersections and gendered ageism. I think gendered ageism and those accusations of witchcraft that you were saying, and I was not aware of the recent reports that you were mentioning in Kenya. I mean, this is a terrible manifestation of ageism in very concrete context, and I think it's important that these are brought into light so that people do not see ageism, as we were mentioning earlier, as just something that relates to maybe older people being stereotyped and that does not have severe effects, I mean, in this case, on the direct life of 4 women in those countries. I think experiences like this and stories like this can again continue to increase awareness about the importance of addressing ageism now, and not continue to wait and continue to accept ageism as something that is just there and will continue to be there. As I was mentioning earlier, we all have a role to play in challenging it. And finally, I really welcome the contributions of Amal in terms of how specifically ageism is present in emergencies, based on that first expert meeting that took place a few years ago in New York, and how that has led into some form of progress, but we need a lot more action so that older people stop being neglected in emergencies. But I mean, I think we've heard enough today that emergencies is just one setting. It tends to be in every setting, and emergencies, because of the heightened vulnerability of that context, are a place where it's even more present, if anything. So thank you for the 3 of you for the wonderful contributions, and I hope that we have some time to get questions from the audience.
Okay, thank you very much for your good response to the discussion. I would like to have a time for any thing that for discussion can add, or to talk about more about what you want to do, to tell us and discuss, and what you have not have done for enoughly, and you can have a time to talk about a little bit more about the discussion. And anybody, any discussions, and 2 discussions we can participate here for discussion, and Dr. Chung and Dr. Stovell, and you can have time to talk about a little bit more. And then we come back to general discussion and pre-discussions among our participants. No? Anything? That you have anything? No? Okay. Dr. Stovell, you don't have any? Okay. You don't have any more thing to talk about. Okay. Any question or comment on the speaker and the discussion on these topics of this post sessions? And here we get an answer from the participant here. All right. One participant raised a question about the measurement of the ageism, and how can you, maybe Dr. Fuente-Núñez, I think you can answer this question. How can you measure that ageism is more prevalent in mid and low-income countries? When you say that there is a lack of data apart from Europe. And yes, I also questions about that, about the judgment, and the measurement scale is not is completed, and so the WHO is going to develop a global scale of the ageism and to measure more precisely the ageism all over the world. But what is the basis of your judgment of the ageism is more prevalent in mid and low-income countries?
Yes, thank you. Thank you very much for that question. I guess I should have clarified. So we do have data on prevalence of ageism against older people from many countries in the world, including low and lower middle income countries. What we are lacking, or where we see less data, is when we look at, for example, the manifestation of ageism in specific institutions, or, for example, the impact of ageism in different countries. And most of the evidence that we have in those two areas comes from higher income, upper middle income and high income countries. So these are two areas where we hope to have more research done in the coming years. It's important to see, for example, how ageism manifests in employment in low and lower middle income countries, where, for example, we see a higher presence of older people in the informal sector. So those types of information and that type of evidence we don't yet have as much of as we have from other settings. Same when we're looking at the impact of ageism, for example, on health. We would like to see more studies exploring the impact of ageism on health in low and lower middle income countries. Or, for example, more studies looking at the implementation of the strategies that I mentioned that work in addressing ageism in different settings. We need to make sure that we take into account potential barriers or facilitators that can help us implement those strategies across settings. It's not the same to implement a strategy in a high income setting as in a low income setting. So the more evidence that we have, the better, in the sense that it will allow us to better implement and design those strategies that are adapted to those different contexts. I also forgot to make a reflection on the comment that was made earlier about the scale of ageism. It's true that in the process of developing the report, we conducted a systematic review, which basically looked systematically through all of the evidence that exists on existing scales to measure ageism. And what we found was not very hopeful, in the sense that we found that available scales to measure ageism are either of inadequate scope, so they don't necessarily measure the 3 dimensions of ageism that I mentioned. So they don't measure stereotypes, prejudice, and discrimination, but maybe just focus on 1 or 2 dimensions. Or what's perhaps worse is that they're not of adequate validity. So they fail to adequately measure ageism. So what we're doing now, and we're in the process of doing this, is to develop a new scale of ageism that we hope can help us accurately measure ageism across countries in the coming years. This will be important for a number of reasons. First, we want to make sure that we have accurate information about the prevalence of ageism against all age groups across countries. We also want to learn about whether ageism is being reduced in countries that are going ahead and implementing the strategies that we know work. So again, we're currently in the process of developing this scale. This will be a longer term project because it requires multi-country testing. But we're already, it's already been started as a process, and we're hoping to make it available in the coming years. Thank you.
Okay, okay, thank you for the. I like the report that WHO has very extensively reviewed the existing studies and scientific data existing, and I think the most comprehensive review is reflected on WHO's report of the ageism, but as the report pointed out that the measurement scale is not really, with a good validity and reliability. So I am very much glad to hear that WHO is going to develop and with their collaborator to a very globally applicable measurement scale of the ageism. And then we can measure more precisely what the ageism is, and we can compare between country, between culture, and I think that will be a great job in the near future. I think it is important. In relation to this, I have a question about that. When do you expect that complete development of a new global scale?
Yes, so as I was just mentioning, so we kicked off the process last year, but it's a 4 to 5 year project. Because it requires if you want to do it correctly in terms of validating the scale, it requires many different phases of refinement and then multi-country testing, translation, making sure that the translations work. So it's a long project, but it's one that's much needed, as I was mentioning, because otherwise we won't be able to accurately see where we're going in terms of this area of work and whether our actions are having the effect that we hope.
Okay. As far as I know that the Global Aging Center here, the organization is organizing this international forum on right of the older person, have tried to develop a ageism scales to be applied to an Asian and the European country, but we have not really succeeded. But I think this is important. And I think this is a very important thing that why you think that is the cultural perspective. And we have to really consider the cultural dimension about the ageism. And, in every people here is the cultural variation is very important in judgment of what is the ageism, what is not the ageism. This is important. I think I would like to tell you about that. You may also know that the importance of the cultural dimensions of the defining on the measurement of the ageism here. Okay, and any other question and comment related to presentation? And Dr. Stovell, you have raised the hand? No?
I have, there's no digital hands to raise, so I thought I would raise a physical hand.
Mm-hmm.
I think that point about culture is really interesting, and I just wanted to share a reflection from conversations that I had recently and then a number of years ago. But when we started talking about ageism, and I was talking to colleagues in different countries in Asia and different countries in Africa, and something that was really interesting that was coming back to me was I was being told that ageism doesn't happen in my country. Ageism doesn't happen in Kenya. Ageism doesn't happen, in Cambodia. We take care of our older people. Our families take care of older people. So I think it really, we were talking about settings. I think ageism in the family is something that would be an interesting thing to look at. And I think, where family members, we all care for our older relatives, and something happens where we think that we know best, and we should make decisions on behalf of someone else. And I think in terms of, sort of that interpersonal ageism that happens, it's very interesting. And then just something else in terms of, we did a qualitative pilot research project a few years ago, and I think something that is incredibly important is that and which was also in the global report, but is just the fact that we keep on asking older people about their experiences of ageism, as well as younger people. But I think there are so many things and so many sort of intersections that we should be looking at that maybe we're not aware of now. But if we keep on talking to older people, as time goes on, new things are going to be popping up. So thinking about ageism and digital exclusion, but yeah, just that piece about really needing to listen to older people and hearing from older people themselves in terms of that lived experience, I think is incredibly important.
Okay, thank you. Very good comment on that point. Any other question and comment to the speakers and discussions? We have almost approaching to the end of this session, and if you don't have any more question and comment, and I would like okay, you can, okay.
It's a bit difficult because it seems like the screen is behind you, so you don't see whether we have our hands up or not. No, I just before we close, I guess I wanted to remind everyone that we have the initiative Ageism Through the Ages running at the moment. So if any of the attendees or anyone who listens to this video afterwards has any contributions, any resources to share, or even your voice, if you want to share any experiences that you've had of ageism, we really welcome all contributions on the platform for the Decade of Healthy Aging. We will become, as a movement, as rich as the contributions that we have. So we really hope that you can all contribute and look forward to receiving those contributions. I don't think I can provide the link to it here, but hopefully that can be made available by the organizers of the conference at a later stage.
Thank you very much. Okay, now we are going to closing this session, and now I'm going to thank you for the presenter and speaker and discussant and for your good effort for this session. And I would like to thank you for those people from Korea and overseas, and to stay with this moment here in this session. And I would like to urge all the participants and particularly, I want to talk about one comment about, the ageism there are many policy and many ways of, combating ageism here. I would like to urge all social leaders, including some people here and those who are listening what I'm saying, and in public and private sectors of the society, many of whom are age 60 and over, and to take the lead in combating against ageism. And usually these leaders in public or private sectors tend to be not so sensitive to the ageism, even though they are of old age. They usually believe the fact that chronological age does not match the biological age. However, they usually deny the fact that in the case of others of their same age, they are not, believing that chronological age is equal to the biological age, but to other persons, they apply that kind of logic. This is the very important thing. So I'd like to urge all the social and the political and cultural and educational leaders who are already of old age to be more sensitive about the ageism, not to themselves, for them, other people, for the common good of our society. Thank you very much. And I hope all the participants of this session and to be a leading soldier combating against ageism. Thank you very much. And goodbye, everybody. Thank you.